Hello Professor, my name is Gulbagh Singh and my student ID number is 117913244, and today I am going to perform the procedure of head to toe assessment, and now I am going to provide you with 360-degree angle of my room. And so now I am going to begin with my procedure. First of all, I perform my hand hygiene and also check for client identification. Hello.
Hi,
Can you tell me your name and date of birth?
Amandeep Kaur,
Can
April 17,
Can you show me your identification? Okay, thank you so much, Aman. So I have confirmed two identifiers, and now I'm going to perform with my procedure. So hello, Aman. My name is Gulbagh Singh, and I am your registered nurse for today. And the doctor has prescribed me to check your full body, that is assessing full from head to toe assessment for checking any kind of malformations or any kind of problem. So are you comfortable?
Yeah.
Okay, thank you. So I'm going to maintain the privacy first, and I'm going to begin with the neurological assessment, and for that I'm going to ask you questions. Can you tell me where are you at this point?
At the hospital.
What is the time?
It's 8 p.m.
And can you tell me the name of your best friend?
Gurjeet.
Okay, so my client is oriented to person, place, and time and is not confused and is fully conscious. Moving forward, I will check for any kind of stroke symptoms like facial drooping. For that, Aman, can you smile for me? Can you clench your teeth? Can you tighten your eyes and raise your eyebrows? Thank you. There are no signs of facial drooping as well. And now for slurred speech, Aman, can you say light, tight, dynamite?
Light, tight, dynamite.
My client is having no sign and symptom of a slurred speech as well. Now, Aman, I want you to stand up. Now I'm going to assess pronated drift on my client. Aman, can you do your hands like this and close your eyes for me and count till 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Thank you so much, Aman. You can have your seat. So the pronated drift is also negative. Now I am going to assess the pupillary response of my client, and the assessment is per law. For that, Aman, I am going to dim the lights a bit, and you have to focus on my right shoulder, and I am going to flash the light first on your left eye, then on the right. Now simultaneously checking the consensual, flashing light on left, flashing light on right, and checking the left eye. Alright. So Aman, one more thing where you have to focus on my finger and I'm going to move it towards you. Okay, as per my assessment, the pupils are equally round, reactive to light, and are accommodated. Now I'm going to move further for the respiratory assessment, and Aman, for that I want you to breathe. So as my client is breathing, I can see that there are no intercostal retractions. The breathing is also non-laboured, and there is no use of accessory muscles. Can you, Aman, just face that side? And now I'm going to check for posterior wall expansion. Can you breathe? Okay, thank you so much, Aman. The posterior wall is expanding equally, and there are no signs of labored breathing at all. There were no bruises. The skin is intact. No sign of cyanosis or bluish discoloration of the skin. Now, Aman, I am going to auscultate your breath sounds. Whenever I place the stethoscope, you have to deep breathe. And I'm going to start. I have assessed 8 anterior landmarks. Now I'm going to assess 8 posterior landmarks. For that, thank you so much, Aman, for shape shifting. Starting from the apex. Thank you, Aman. You can come back to your position. Uh, while I was auscultating, I did not find any kind of sounds like wheezing, crackles. The lung sounds were clear bilaterally. There is no sign of any kind of fluid filled in the lungs. Now I'm going to move towards the heart assessment, cardiac valves. And now, first of all, I'm going to auscultate the aortic valve, which is present at the second intercostal space towards the right sternal border. Now for pulmonic valve, second intercostal space, left sternal border. At the third intercostal space, left sternal border is Erb's point. At fourth intercostal space is tricuspid valve at left sternal border. At fifth sternal border, at fifth intercostal space towards left mid clavicle line is the mitral valve, and where I can hear the apical pulse, and this I'll hear for 30 seconds. Thank you, Aman, for cooperating for so long. So the heart rate was 72 beats per minute. The rate was regular. Strength was 2 plus. And while I was auscultating the heart sounds, there were no sign of any extra sounds. S1 and S2 were loud and clear. No murmur was heard. Now, Aman, I want to assess your abdomen. Can you just lie down? First of all, I'm going to inspect it for the contour, asymmetry, and any kind of skin. For skin deformities, the abdomen is flat, non-distended. I cannot see any kind of breakdown in the skin, any scars or abnormal bluish discolorations like ecchymosis or petechia. Now I'm going to move further towards auscultating the vowel sounds, and for that I'm going to start from the right lower quadrant, moving towards the right upper, left lower quadrant. Alright, so the vowel sounds are normal active. Now I'm going to palpate your abdomen. I'm going to press a bit, Aman. If you feel pain, kindly tell me. I'm palpating it for any kind of lesions, masses, or any irregular herniations or tenderness. Did you feel pain, Aman?
No.
So the client's abdomen is also non-tender. And now moving further, I'm going to assess my client for integumentary system and musculoskeletal system. And moving further, first of all, I'm going to check my client's skin temperature, and the client is warm to touch, and side by side I'm assessing for any kind of blisters, marks, or any kind of lesions, any sore that is having irregular borders, but I cannot find anything. Checking the bony prominences for pressure ulcers, I cannot see any grading of pressure ulcers till now, and the client has having did you feel any pain?
No.
So my client is not having any pain as well. So I'm checking for the skin turgor. As I'm pinching my client, the skin is returning back to its normal position. No signs of dehydration. Checking the capillaries and the nail beds of my client. As you can see, I am pressing and the blood is returning within 2 seconds. Capillary refill is also within 2 seconds. Circulation is good. The nails, fingers are not clubbed. There is no deformity. Aman, can you do like this? Flex your arms. No found. Same with your knees. Alright, thank you. You can go back. So there is no deformity upper and lower extremities. For musculoskeletal strength, can you sit down, Aman? Now, Aman, I want you to do like this. I'm going to push, you have to resist. Alright, and now I'm going to pull, you have to resist. Alright, now for the strength, Aman, can you do like this? I'm going to, alright, now I'm going to push down. Thank you. Can you lie down for me one more time? I want you to make sure that your pulses are also good. So first of all, I'm going to assess for the carotid pulse, which is between groove between trachea and sternocleidomastoid muscle. Alright, for other side, the pulse is 2 plus and is regular. Strength was 2 plus. And now I'm going to assess for the posterior tibial one pulse, which is behind the medial malleolus. it is palpable and the strength is 2 plus. Checking for the dorsalis pedis between first and second metatarsal. Pulse is 2, yes, palpable, 2 plus and regular. All the pulses are regular. Thank you so much for the cooperation, Aman. So this was the end of my head to toe assessment, and now I'm going to provide 360-degree angle of my room. Thank you so much.